Hello again, everyone. I'm Yan Nong, and this portion of the Safe Babies Guide to Implementation training is targeted towards the clinic decision makers and those who will be planning for the implementation of the PAP. Our objective for this module is by the end be able to determine who would be able to implement the PAP and when during the well infant visit workflow would it be best to implement it. We will also identify strategies to help you successfully implement in your clinic. The PAP can be implemented by a variety of staff members at the clinic. Staff members that have implemented the PAP in other pediatric clinics include pediatricians, nurses, medical assistants, health educators, community health workers, and college graduate interns. What we have learned is that there are some key characteristics of staff that help them be successful in implementing the PAP. Those characteristics are empathetic, understanding, a good listener, and are easily adaptable in kinetic situations. Any staff who has been trained in motivational interviewing and is comfortable using it would also be able to implement the PAP successfully. Again, with proper training, staff of varying clinical degrees can discuss the PAP with maternal caregivers. The PAP should be shared and discussed with maternal caregivers at the 2-week well infant visit. The PAP should be revisited at well infant visits up to 6 months as a follow-up and continued support to the maternal caregivers. The PAP was designed to enhance what is already being discussed with caregivers at the well visits based on Bright Futures guidelines. Clinic management and staff will need to consider the current workflow in your clinic and decide when during the infant well visit would be best to provide the PAP. With that said, it is important to first identify staff members in your clinic who, 1, have time to implement the PAP, and 2, have the key characteristics or training in motivational interviewing. It takes about 10 to 20 minutes during the well infant visit to complete the PAP and think about the characteristics we previously discussed. Who among your staff members will have time within their role in the clinic to provide the PAP and also the characteristics needed to successfully implement it? Use the staff decision worksheet as seen in this slide that can be found in your training manual to help you identify staff best suited to implement the PAP. We recommend having staff members you place in the top left box or the yellow box to implement the PAP. However, we understand that there are logistical reasons that may require you to ask the staff members in the upper right or lower left, the gray boxes, to implement the PAP. The purpose of this worksheet is to help you identify the different options you have in your clinic and choose based on what is possible. Remember that the success of the PAP is very much dependent on the person that is providing it. After determining who would be the ideal staff to implement the PAP, it is necessary to determine when those staff members can implement it. Brainstorm the ideal time during the visit that each of the staff identify would be able to implement using this worksheet that is also in your training manual. Clinic management and implementing staff members should work together during this process if possible to decide when it would be best to provide the PAP to maternal caregivers within the well infant visit workflow. Again, you can find this table in your manual, and it is also available for download in the training website. There are a couple of ways that you can examine your workflow to determine realistically when the PAP can be administered. The first step is to think broadly about your clinic's flow. Is there an optimal time between appointment check-in through when the appointment ends that would allow for a 10 to 20-minute discussion with the maternal caregiver? Is there a long wait after patient checks in that the PAP could be given? Or is there a lull once caregivers are in the exam room that could allow for a discussion? Or do maternal caregivers move through the clinic flow fairly quickly so it would make sense to share the PAP at the very end of the visit? Now that you have staff members in mind who could do this successfully and brainstorm some possible options for implementation during the well infant visit, use this workflow worksheet to map out your ideal clinic flow that includes the PAP. In each box, include the staff, task they are doing, and estimated time for the task to clearly outline the workflow. Here is an example of one clinic's flow and where they have decided to implement the PAP. For them, it made sense to discuss it while moms wait for the heel prick results. We encourage every clinic to do what works for them and where they feel best they can engage the maternal caregivers in these conversations. Again, you can find a blank flow sheet in your manual, and it is also available for download in the training website. Having the workflow completed does not mean you are ready to get started. That is just one of the first steps. There are a few more things to consider to ensure the implementation and program will be a success. We will discuss 6 key considerations today. The first consideration is, are there any organizational barriers that would hinder implementation of the PAP? It is important to review staff capacity and their training. Also, it is necessary to ensure clinic flow can accommodate and be flexible to the PAP, since the discussion really depends on the need of the maternal caregivers, and that will affect the length of time for the discussion. The second consideration is, if the discussion with maternal caregivers result in need for additional services, how will it be addressed? Some examples of needs include when the maternal caregivers can't identify another safe caregiver for the baby, or if she is asking questions about concerns not mentioned in the PAP, or are showing signs of postpartum depression, a danger to herself and or her baby, and also if she discloses violence in the home. It is vital that your clinic plan for when these possible issues come up so staff can feel confident in discussing the PAP and are equipped to handle them when they come up. Here is an example of a plan of action worksheet to help you plan ahead for these possible issues. Again, it is necessary to have a plan for needs listed on the worksheet. Please add others that you think may come up with your patient population. This is an example of how a completed worksheet looks like with the key issues, what is the action for when it comes up, and how often to revisit the action to make sure it is still the best plan. A blank form can be found in your manual and also downloaded through the website. Another key consideration is how to get buy-in from senior management to frontline clinic staff. Without buy-in from staff, it is hard to have a successful program. So when possible, discuss the PAP and any potential new protocol at as many meetings with management and staff as possible. Share previous findings on the benefits of the PAP, the importance of this work, and address any concerns staff may have. Also, allow time or different options for management and staff to give feedback, ask questions, and voice concerns. This next key consideration is how to implement the PAP without causing additional burden on staff. This can be done by listening to staff concerns, as we discussed previously, and adjusting protocol as needed to alleviate staff burden before implementation. It is important to be flexible after implementation as well in case more adjustments need to be done to alleviate staff burden. The fifth consideration is how to best present this to maternal caregivers and engage them in the PAP discussion. It is important to be transparent that this is now part of routine care for all well infant visits starting at the 2-week well visit. You should share why it is important to discuss the PAP with maternal caregivers by saying something similar to, "We want to ensure you have the support you need during this first year with your baby." Always be open to addressing any concerns maternal caregivers might have, and ensure that motivational interviewing is being used when discussing PAP with maternal caregivers. The last consideration is how to ensure the PAP is being implemented correctly. If you can get the program started, but it is not done correctly, then the time spent may not really be helpful to the maternal caregivers as was intended. Therefore, consider having routine check-ins or meetings with staff providing the PAP to discuss the process and address any issues or concerns that arise immediately. You can schedule weekly meetings when first starting, when more issues may come up. Then once a month when everyone is more comfortable with the process and issues are more or less smoothed out. Also, identify a few metrics to measure success of implementation, such as number of patients that receive the PAP out of all those eligible, and ease of staff in using motivational interviewing techniques while administering the PAP. This concludes our module for planning for implementation of the PAP. We hope this webinar, the worksheets, and key considerations will be helpful as you plan for implementation. Please refer back to the training manual or webinar as much as needed. Thank you for your time and for being part of the Safe Babies program.